Well, um, and again, it depends on what definition you apply to the world of brain-computer interfaces. But to me, first of all, it's about solving a therapeutic need. It's solving a real health problem. So we don't see at INBRAIN, we don't see BCI technology in a way that goes and augment healthy people. This is not what we believe on.
So welcome to Impulse, Carola. Thank you for accepting my invitation and for finding some time within your busy schedule. We have a topic for today that's been at the center of media coverage over the past weeks. We are recording this in February 2024. So there's been some major progress in the field, and I'm talking here about brain-computer interfaces. So Neuralink, one of the many companies from Mr. Musk, for those who have not heard of it, they showed a few days ago that they had successfully implanted their first human patient with their technology, which will be used in general to record motion-related thoughts in the cerebral cortex. So I'm very much external to the field. I observed that there's a lot of speculation and fantasy almost about how these technologies could be used and for what purposes. It feeds for sure an incredible amount of hope in certain medical areas, notably in motor rehabilitation. We talked on the podcast with Dr. Jocelyne Bloch in episode 6. So wonderful neurosurgeon whom you might actually know in the area of Lausanne. And one aim, from my perspective for our conversation today would be to demystify, the noise that's created around BCIs or brain-computer interfaces, understand where the field is at, where it's going, and learn about, what can be expected of it and what not. So I'm looking forward to hearing your perspective on all these things, Carola, as you and your team at INBRAIN Neuroelectronics are spearheading the field and are literally in the midst of the action. But before we go there, I would invite you first to present yourself.
Thank you, Matthew. It's just a pleasure to come to Impulse today. My name is Caroline Aguilar. They all call me Carola, as you already did. And I'm a pharmacist and a neuroscientist, but mainly working on business and market development all my life in international scopes. So, pleasure.
Thanks. And so tell us a bit about, what the mission of INBRAIN Neuroelectronics is before we go into the specifics of brain-computer interfaces.
INBRAIN Neuroelectronic is a company at the intersection of Medtech, digital health, and deep tech that uses graphene to decode neural signals into breakthrough medical solutions. We do so by looking at the brain in high resolution so we can help the mankind solving the neural challenge.
And so you mentioned graphene. What is particular with that material? Why graphene?
Yeah, so graphene is carbon. It's a bidimensional material. It's a Nobel Prize winner material. Two researchers isolated at the beginning of the 2000s, and in 2010, these researchers got the Nobel Prize. Is the thinnest material known to man. It's just an atom thick, yet is about 200 times stronger than steel, and it's very flexible, biocompatible, and it's an excellent conductor. So it makes an excellent candidate as well for neurotechnology.
And so basically at INBRAIN Neuroelectronics, you're approaching brain-computer interfaces from the new technology you're providing enables better sensing of the neural signals, a better stimulation. What does it change compared to what other companies are doing actually?
So we have two graphene technologies, but both enable high density and high resolution. So pretty much in terms of density, we can go to extremely small contacts of about, we can go to any size, but to make them actionable, we start at 25 micrometers. So between 25 micrometers to, let's say, 300 micrometers is the sizes that we are now most used in. So there's this density in a very micrometric fashion that we can use. We can go up to 1024 contacts, but it's also the resolution. At the end, graphene can inject 200 times more charge than platinum and iridium at a very low impedance. So the signal to noise ratio is extremely good. And Also, we have this other technology that allow us to see frequency bands below zero point 0.1 hertz, so things that metals mainly cannot see. So we can go from minus 0 0.1 hertz to kilohertz. And so all the spectrum of frequency bands that the brain uses to communicate is what we are aiming to decode.
And so this has the potential to be used basically in any brain-computer interfaces, right? It's like you basically provide a platform that enables to increase the resolution of the signals and the quality of the information to be transferred.
Yeah, and on top of that, typically brain-computer interfaces have been using the decoding side of the interface, right? The reading.
Yeah.
However, when we find therapeutic approaches, is on the stimulation, and even better on the combination of reading and then responding to that pathological biomarker, for instance, and therefore creating a closed loop. I think to me, that's the ultimate brain computer interface if we can do it at high resolution, because at the end, decoding is quite limiting. Yes, you can move objects, yes, you can program action, intention, but at the end, therapeutic approaches are really delivered while you stimulate. So I think this is extremely important, and probably expands the concept of BCI technology, which is actually what we want to.
Mhm. And so I think that's in line with what you were saying. Like, where is the need actually, coming from for BCIs? Why is it needed? Why couldn't we do without? And so, what are the first indications where you see in-brain neuroelectronics playing a role? So the first indication would be Parkinson's disease. Would there be like, what would be the kind of like the adjacent ones or the next ones? Could you double click on the point that you mentioned that you're running the company as a biotech company? What were you meaning in that regard? I understand. And so could you explain us, if we take the example of Parkinson's disease and deep brain stimulation, what are the benefits of increasing the resolution and, basically all the advantages you listed from a technical perspective? How does that translate in terms of clinical outcomes? What's the state of the evidence there? I see, because I understand. And if we go back to the episode 6 I mentioned with Jocelyne Bloch, so she was explaining to us, the device they're using. So it's like, I think, a 16 electrode patch that they put on the spinal cord. So if you manage to double, triple, or whatever, by whatever factor, increase the resolution and the number of actually electrodes you can place on that device, like you just, selectively much better stimulate the patients and restore the walking pattern in the case of their work. So I see that this is has a huge potential. Could you explain us? So where is it? Are you guys building this on yourselves? How is it? Is the manufacturing happening in house and so on? I see. And how? I see. And so for the indication, for example, of Parkinson's disease, how far in the clinical development are you with the company? Or, in other words, when will human patients benefit from the technology? I see. And what are some of the risks that you foresee for, I would say in general, not necessarily just for your specific technology, but yeah, risks that you foresee for patients that would adopt, these brain implants? For example, we talked about the first person who got the Neuralink device. Given the current state of the technology, are there actual big risks or no risks at all? Because if you ask the general public, some people freak out about this. Some people are, yeah. Yeah. You mentioned at the beginning that's maybe taking us a bit away from what we're discussing now, but you said like you would not see, the use of BCIs for augmentation, like for people who are like you're healthy, you do not justify that. So you basically don't foresee, healthy people like you and me using such types of devices in the next 5 to 10 years, right? It would be more for purely for medical reasons.
There's a sign of for that is right here. That's why that's very so like the benefit will has to be but you know very
Yeah. Yeah, no, and I relate to these points. And do you think in that time frame, 5 to 10 years, there will be in for the relevant indications, BCIs would be just like a common approach. I mean, it's already used for the brain stimulation. We talked about it, but I mean, using, for example, your technology specifically, do you think in that time frame this will be democratized? Yeah, it's already at capacity. And do you foresee those technologies to be, affordable to most? Because to me, it sounds like these are, yeah. Yeah, for that purpose. needed. Yeah. And so I imagine you're already in discussion with some of the providers and the payers in the US as to how to make that happen once, your product is going to be commercialized.
But I don't know that break that wall. You cannot lose that it works. Where we talk about here, rather than that data really.
And on that, so the benchmark, for example, in the case of Parkinson's, is it the benchmark would be deep brain stimulation, but in some other indications that where you would approach the therapy in a completely new way, where there is no basically good standard of care or anything alternative. Like, for example, if you talk about motor rehabilitation, maybe there are like exoskeletons, I don't know, but it's like there are two categories. Like there's one where it's like an incremental change, maybe the one for DBS, and then you're looking for something even, much, much bigger in a way where you're really like enabling to solve a problem that was not solved at all before. Yes. I see. So we covered, you explained us, the reason why INBRAIN Neuroelectronics is there, that there is where there is a medical need for BCIs, that's where it makes sense. You explained us how the technology works, who would benefit from it, how you would actually commercialize it with that value-based approach we talked about. You mentioned you were working in Medtronic before joining INBRAIN Neuroelectronics. What convinced you to make the change? Because you moved from that. I guess they are like the leaders, right, in Parkinson's disease and with the DBS treatment. Yeah. What convinced you to join INBRAIN Neuroelectronics? Yeah, it's a huge company. Yeah. Yeah. Thanks for sharing that. Another thing maybe that's also related to, career development and trajectories, like professional trajectories. So far, you are my fifth female guest on the show, over 27 episodes recorded. So I think it's a way too small number. What would you say to our female listeners who are, eventually aspiring scientists or businesswomen willing to have a career in the biotech or medtech industry? Like, why did you choose that path? Why do you think it's nice? What are some of the limitations? Like, kind of like your open perspective on this. It's interesting. I think Daniel Kraft, you might know him. He told me the same on episode 12. Yeah, he told me exactly the same. So yeah, no, that's very inspiring. Thank you for sharing that. So I'm looking at the time. I think we're shortly, coming to the end of the episode. And I mean, that was super interesting. I really like what we discussed about this thing around, having a therapeutic need that justifies BCIs, and there's all these fantasy. I'm like, when I look at like medias and stuff and people coming up with those crazy ideas of, augmentation and so on. But I share, your point that doesn't really make a lot of sense for me. So yeah, no, thanks a lot for sharing all these things. There's a bunch of recurring questions at the end of each episode I'd like to ask you, Carola. So the first one is for the curious ones listening to us who would like to, learn even more about BCIs, about your technology at INBRAIN Neuroelectronics. What resources would you recommend them to check out to know more about it? It's a good source. Thank you so much. I'll put all the links in the show notes. Thanks so much, Carola. I'm blushing. Can you share with us an anecdote from your work at Brain that made you realize the impact that you were having on patients' lives? So you mentioned you're about kind of like to get into first in human use, but yeah, if there's anything you can share in that regard already.
That but basically,
Yeah, I'm sure there will be more very soon. And it's interesting. Like, I think it's the first time, someone on the show tells me that they set up, or let's say at the stage where you are, that already, established a patient, sort of like patient console, and have that close connection to them. I can imagine for employees, it's really, really helpful and yeah, huge motivational driver. Thanks a lot for sharing that. So yeah, in every episode, I get a lot of inspiration from all the guests I have the chance to have on the show, and without a doubt, you're no exception in that aspect. There are surely other pioneers in the medical field. We mentioned Matt Engel, and some of the other companies operating in a similar field as you do. But if there would be, one or a few you would recommend on the show, who would those be, and why would you recommend them? You're a soft paralyzed. The person. Mhm. Mhm. You put me in contact with all of them now. Let's see. But no, I think, I'd like on the topic on my list. The brain computer interactions. That was one of the first episodes we discussed. We discussed it today, but I hope I can have also like a follow-up conversation with some of these folks going forward. Yeah, but thank you so much, Carola. I learned a ton of things. I think people will really appreciate the exchange. Just for those that are still with us, thank you for dialing in. If you think that the conversation has been useful and you know someone who would benefit from it, please share it with that person. I also continuously receive feedback about the episodes and the podcast, and I'm really, really thankful for that. So please continue to do that. You can subscribe on any streaming platforms. Please leave us also a 5-star review. That would be very appreciated. And you can follow our activities on LinkedIn, the website, the podcast newsletter. And yeah, that's it. See you. Thank you so much, Carola. I wish you all the best with INBRAIN, and I hope we get to see each other soon in Lausanne or elsewhere in Switzerland. Thanks a lot.